Hello and welcome to Speak Out on Strangles, the Strangles Awareness Week podcast, which aims to give horse owners a real insight into preventing and managing the disease. Strangles is the world's most commonly diagnosed infectious disease in horses. Although cases can go from mild to malicious, it is extremely contagious and can have devastating consequences for people passionate about enjoying life with their horse. Strangles Awareness Week is supported across the equestrian industry in the UK and across the world, and it calls for more openness and support for people and premises affected by the disease. With these podcasts, we aim to inspire open conversations about strangles and what helps in taking us closer to eradicating the disease. I'm your host, Gilly Rydick. I'm the Campaigns Officer for Redwings Horse Sanctuary and Coordinator of Strangles Awareness Week. And today we will be talking to two vets, Professor Scott Pirie and Amy Smith, on their role helping their clients to prevent and manage strangles. Please don't forget to subscribe, whether you are listening on YouTube or on your podcast player, to get the heads up about future episodes and, more importantly, share them with your yard, coach or vet. Let's spread the word and not the disease. Welcome everyone. On this episode of Strangles Awareness Week, we will be talking with Professor Scott Pirie, Chair of the Equine Clinical Sciences at the Royal School of Veterinary Studies of Edinburgh and the Roslin Institute. Welcome, Professor. If you'd like to introduce yourself.
Yeah, sure. So my name's Scott Pirie. As Gilly said, I work at the Dick Vet in Edinburgh. I've been there for, about over 30 years now, and I work in the internal medicine department in the equine hospital. So my role there is 1/3 teaching, really, 1/3 research, 1/3 admin, and like I say, my clinical duties are in relation to equine medicine, with a particular interest in equine respiratory disease.
So what was it about strangles that was so interesting to you compared to other potential equine diseases that you study and treat?
Probably the most interesting thing about strangles, and equally so the most frustrating thing about strangles, really comes down to the causal bacteria and its ability to ensure its survival and its transmission from host to host. So it has a number of properties that allow it to do that, really, from adherence onto the respiratory epithelium, its ability to invade that epithelium, its ability to colonize the lymph nodes, evade, which is a big one, evade the host immune response, which the horse is clearly going to rely on to try and clear that bacteria in the acute phase of the disease. And then, as I'm sure many of us are aware, its ability then to, in many cases, ensure some form of carrier status, not in all cases, but in a proportion of cases, by causing abscesses that then rupture internally and create this carrier state, which ultimately leads to the bacteria ensuring its likelihood of transmission onto another host. So I think it's the ability of the bacteria to do that makes this an interesting disease, but it's also that ability that makes it a difficult disease to deal with, both as a veterinarian and as an owner or yard owner.
Could you explain a bit more of how the process of how you get cases referred at the Royal Dick?
It's probably not the norm, because working in a hospital environment, so we have an ambulatory sort of primary care practice at the university as well, and I work exclusively within the hospital, and we would take secondary and tertiary referrals. And the hospital, like any facility really that hosts a gathering of horses, does represent a potential meeting point and potential source of spread of disease. So we do have very strict biosecurity measures in place that would minimize the likelihood of introduction of cases, in other words, cases that are not showing typical signs of strangles but maybe carriers, and we adhere to those very, very strictly. And therefore, actually actively admitting cases would really be restricted to horses that really their clinical need perhaps can't be met by the situation in primary care practice. So I'm talking about things like transendoscopic removal of chondroids from the guttural pouch. If the referring practice didn't have an endoscope, or they didn't have the basket forceps or the snare to remove those chondroids, or surgical removal of chondroids from the guttural pouch. So these would be the kind of more complicated cases that we would see from a referral point of view, and all of those cases clearly would go into our isolation facility, and all procedures and interventions would take place at that facility, even anesthetics, to keep them totally separate from the hospital. So yeah, we tend to see the complications associated with the disease rather than dealing with acute clinical cases themselves. Although the ambulatory practice, clearly, like any practice in the UK and worldwide, has to deal occasionally with cases on yards and containment of disease spread within yards, etc.
Do you have a particular case that stands out in your mind?
That's a good question. I guess categories of cases maybe that stand out in my mind. Firstly, would be those cases that, for want of a better term, haven't read the textbooks. So those cases that haven't followed that typical clinical course that the vast majority of acute strangles cases would follow. And it just increases your level of vigilance, really, to try and identify those cases from the outset. Obviously, like I said before, in a hospital environment, that's vitally important to do that. So those would be cases that might present with difficulty swallowing, where there might be other differentials that might be on your list. But I think when they present purely with that clinical sign, even though they don't have the typical kind of high rectal temperature, there's no history of it in the yard, there's not been any recent movement, even just that single presenting sign, we would often be pretty vigilant and say, well, let's rule it out before we go any further with this diagnosis, or before we introduce the horse into the hospital. So these are ones that are always keeping you on your toes, really, because your typical strangles case that has that sort of pussy nasal discharge, high rectal temperature, particularly if it's coming from a situation where there's been a lot of movement of horses, or a new introduction of a case onto the yard, and then they've got the lymph nodes that swell up, that's a very typical presentation, and most people would be very aware of the fact that diagnosis is very much on your radar. It's those more subtle presentations, or slightly abnormal presentations, or the absence of some of the typical clinical signs that can be problematic. So I'm not thinking about an individual case per se, but it's that group of cases that you're always kind of, like I say, you're always on your toes to make sure that you try and identify them as best you can. And the other ones, I guess, would be kind of along a similar line, would be the atypical form of the disease, which effectively is kind of like a milder form. So those horses are less, the severity of clinical disease is a lot less in those horses. They might not develop, lymph node abscessation, so they might not follow that typical clinical course. But the bottom line is that they are still a disease, albeit milder, that is caused by the same causal bacteria, and therefore those horses still pose a risk to other horses. So they might present just with a little bit of a kind of serous, or even a kind of milky kind of discharge down the nose. They might have a mild elevation in rectal temperature, they might not. And again, it's just having an increased awareness of the fact that not every case will read the textbook, and just having a level of awareness that any horse that really presents with, certainly with a rectal temperature and a nasal discharge, even if it doesn't go on to develop lymph node swelling and rupture, still are potential strangles cases unless proven otherwise.
Seems that strangles can take quite a few forms.
Yeah.
What would you say is the most devastating thing about strangles as a disease?
I think you could probably address that question on a number of different levels. I mean, clearly at the horse level, the devastation is associated with the severity of disease. But in saying that, that there are many other conditions and diseases and disorders of the horse that have a much greater severity than strangles. That said, there is a proportion of clinical cases that can be very severe, and the clinical consequences of the disease can even be fatal. So I think that the first level is really at the horse level, and it's the clinical impact on the horse, and we shouldn't forget that we have a duty to minimise the clinical severity of disease in those affected horses and to minimise the likelihood of transmission to other horses. But also, you can look at other levels as well. So obviously the level of the owner, where the impact of strangles on an owner is, well, there's many facets to that really. So one would be the emotional impact of having a horse that has strangles, but the financial impact in trying to either treat or to isolate that horse, the impact with regard to movement restrictions for that horse, so not being able to compete. And then you have the impact on the yard, so the impact on the yard owner, but not just the yard owner, but other people that have horses on that yard that are not clinically affected, where those movement restrictions and isolation protocols are imposed within that yard to try and minimise disease spread both within the yard and from the yard to other yards. So I think that's the main thing about strangles, is when you put all those things together, when you look at the clinical impact, the financial impact, the hassle factor involved in trying to implement biosecurity measures in the face of an outbreak on a yard, then you end up with a disease that clearly is best avoided if at all possible. But also there's not a lot can be done with regard to, or what needs to be done really with regard to implementing those biosecurity measures within the yard once an outbreak has occurred. That's just a given. You've just got to act upon that. So I think really probably what needs to be prioritized is our efforts to minimize the introduction of disease onto those yards. Okay, so that's clearly the starting point, because everything else, all the other impacts effectively derive from the introduction of the disease onto the horse and onto the yard in the first place. So I think that's probably where our efforts should be focused. And that those efforts really would rely on a variety of things, like transparency is a big one. I think appropriate quarantining, appropriate testing, regular monitoring, surveillance, and clearly optimal biosecurity. That's where we can make a difference.
You've mentioned how the disease impacts different people in different ways. So why do you think that's why Strangles has the reputation that it has? Because it is so impactful on so many different levels.
Yes, I believe so. I mean, it is a curse word, isn't it, in the equine industry, and understandably so. And I guess one of the problems is nobody wants to utter those words, or utter that diagnosis. There's a fear of strangles, and that fear, I think, is born out of, it's more the collective impacts that I've just mentioned, on the horse, on the owner, on other owners in the yard, the restrictions, etc. So it's that collective impact, I think, that makes it such an emotive disease, rather than each of those taken, in isolation. They're all intertwined with each other, and I think collectively that's why it is such a problem.
And what's it like for vets? Like, what's the vet's first reaction when they hear the word strangles?
I think it's one of those situations where you're kind of looking at this in two different ways. So in one respect, you're focused on the treatment of the individual animal that's affected, which is, at the end of the day, a large proportion of our job is dealing with individual animals and their clinical presentation. But also you've got this other facet to the whole investigation, which includes minimizing disease spread. So you're effectively wearing two hats. So one hat, focusing on the individual clinical cases, but secondly, as importantly, thinking about ways in which you can minimize spread within the yard. And that's very much dependent on having an awareness of the setup of the yard, really. That's once a case occurs. I'm kind of making the assumption there that a case presents with the typical clinical signs of strangles, and like I say, those would be the two hats the vet's wearing. But then the other consideration is prophylaxis or prevention. So acting in an advisory capacity to minimize the likelihood of introduction of disease onto a yard that has healthy horses in it. So yeah, there's a number of hats that I think a vet would wear. one largely advisory and kind of damage limitation, and the other focused on the clinical cases.
Would you have any advice for vets on how to talk to their clients about the prevention side of things? Because biosecurity is often seen as a bit of a scary word, and a lot of people are unwilling to consider it, unfortunately, until something actually happens on their yard and they do get an outbreak or a case. So how could vets approach that kind of hot topic with their clients?
The term biosecurity is a kind of scary word, isn't it? It's but breaking that down to what that actually means, and a lot of the times it comes down to common sense, and it's like everything in life, isn't it? That sometimes you don't take something seriously until it's a little bit too late. Educating on the potential consequences of not implementing strict biosecurity protocol on the yard, I think, is key. And that's ultimately what's going to land home that message is, how is that going to impact me as a horse owner or as a yard owner, both in my pocket and with regard to having a business that is open and there's not any imposed closures or movement restrictions for a particular period of time. I often feel that sometimes having owners and yard owners that have been through that, telling their story of how it impacted them, can be quite key. Because if you haven't been through it, then sometimes the devastating impact is not overly apparent, really, until it's kind of too late. And the other thing is to say, well, there are ways and means in which, A, you can reduce the likelihood of introduction onto the yard, but equally so, in the unfortunate event that it was introduced to the yard, then are there measures in place that would at least in some way minimize the impact? And that comes down to, again, the facilities that are available, the monitoring of the horses. Education is key, but I think that education has to include a stark awareness of the potential impact if things were to go wrong. So that's key. I think the other thing is seeing the vet and the owner, whether that be the yard owner or the individual horse owner, and preferably both, working as a team with a common goal. The likelihood of compliance really is much, much greater if there's an awareness of the disease itself, how the disease spreads, the measures that can be put in place to minimize introduction onto a yard, the testing measures that are available, the limitations of some of those testing measures is important to consider. Get that information across, because ultimately compliance is going to be much, much greater if there's an awareness of the justification for some of those measures that you're advising. It's like everything, if you understand why you should do something, then you're much more likely to do it. Yeah, that would be my answer. I think education and hammering home the potential impact of not adhering to good biosecurity.
So it sounds like it's a really important partnership, the vet and horse owner partnership, to managing strangles. What do you think owners need to bear in mind when they're talking to their vet about strangles? What do they need to remember? Because a lot of the time, strangles is a quite distressing experience. People can feel a little overwhelmed, and they can forget to ask questions.
Yeah, I think the main thing is if we're dealing with a horse that's already got strangles on the yard, and putting to the side the clinical care of that individual horse, so just focusing on minimizing spread. I think the key thing is, how is the disease spread? What are the main routes of transmission from one horse to another? And sometimes that's not very obvious, because we do kind of get a little bit maybe bogged down with the kind of in your face aspects of the disease, with the rupturing abscesses and what have you. But ultimately, you're looking at reducing spread. What's of much more relevance to the owner is, how are you going to minimize spread from one horse to another? So almost seeing the two things as different. The clinical care of that individual horse is one aspect. The other aspect is prevention or minimization of risk of transmission. So in order to address that, you need to know the routes of transmission. So you need to know about fomites. You need to know how, if I wanted to transmit this from that horse A to horse B, how would I do that? And if you can answer that question, you say, well, that's exactly what you should not be doing. So it's things like sharing buckets, sharing tack, personnel, dealing with affected horses and non-affected horses. All of that information is key. But where I've seen most success is going back to what I said about the whole yard working as a team, and they should all really be singing the same song sheet. And the likelihood of that happening is much, much greater if there is awareness of routes of transmission, modes of transmission, and everybody almost seeing themselves as effectively a link in the chain of effectiveness, and whether your horse is affected or isn't affected. So everybody kind of almost pulling in the right direction, and that's important. And I think in order to facilitate that, then having those yard meetings is important. There's not mixed messages going out there where people are standing up saying, this is where we're at, this is the obstacles that have come our way, and this is why they got here, this is how we're going to try and overcome them. I say people are much more likely to adhere to that if seeing themselves as being a very, very important link in that chain of effectiveness, why that is the case. And the other important thing is having, I hate to use the term, but almost like a chain of command, the effectiveness of implementing a policy really comes down to not just knowing your place within that team, but also having somebody that's calling the shots. And as long as those shots that are being called are evidence-based and there was rationale behind them, then I think it's important that messaging is coming from a single source.
And you've done a lot of work on education on strangles and infectious diseases in general. What positive change have you seen in horse owners when it comes to biosecurity, and what do we still need to improve on?
I get the impression there is definitely an increased awareness of the importance of biosecurity, and I think that's massively increased in light of the current pandemic. An awareness that simple things can make a difference. Washing your hands. We've kind of maybe lost that a little bit with all the technological advances in aspects such as testing, antibody testing, and PCRs and what have you. These all very, very much have their place in controlling disease introduction and informing decisions as to when yards can open, etc. They all very much have their place, but not at the expense of doing the simple thing. One's as important as the other. So I think there seems to be, and again I go back to the current pandemic, there seems to be this awareness that it's a combined effect of the simple things and the more advanced technological things that make a difference. And that's clearly shown with the pandemic when you combine your daily activities with regard to face masks and hand washing and social distancing, and then you combine that with testing and vaccination and what have you. It's a combined effect that is ultimately going to have an impact. So, but I do think that horse owners are increasingly aware of the value of biosecurity, and it's almost like going back to the kind of pony club manuals, that this is the things you do and these are the things you don't do. There's a reason behind it, and I think there was a stage where we kind of lost that a little bit, and we're coming back to that. Those simple things. Checking your horse's temperature every day, cleaning stables down appropriately between horses. Inevitably, yards are places where horses are going to come on and go off on a regular basis, depending on the individual yard. But that's a given. You got to accept that. That's why they're there in the first place. But under those circumstances, are there measures that can be put in place to try and minimise that? So things like quarantining, testing before introduction of horses onto yards. I think there is an increased awareness there, but it's an ongoing process. And again, it comes down to basic understanding of how the disease spreads from one horse to another. What can be done more? I think, as always, increased transparency, I think, is key. Again, going back to the current pandemic, that people that know that they're testing positive, that there's an expectation that those individuals will act responsibly and will self-isolate. And looking at a parallel in horses, then if you know that your horse is positive, or if you know that your horse is very high risk of being positive, then acting responsibly and seeing your role not only focused on your own individual animal, but on the other animals that it's mixing with. So I think one of the issues with strangles in the past, and possibly still now, has been, we said it was a curse word earlier on, and I think that still applies, and there might be a temptation for some people to try and sweep it under the carpet, but you can't. No, we talked right at the beginning about how clever this bug is. So this isn't something that can be swept under the carpet. So having an awareness and acting upon that awareness or acting upon that suspicion is key. Just being open and transparent. It's nobody's fault that their horse has it. The focus should be on trying to clear things up as quickly as possible.
Yeah, I totally agree. It's interesting you mentioned transparency, because of all the people, vets are probably the ones who will get the truth. I know they're called, they'll see the case. So that's quite an interesting thing. Have you ever had any experiences or seen this stigma around strangles in action?
Have I seen it? Yeah, I probably have. But I think I've been fortunate in that the majority of cases that I've advised upon, maybe it's because we try and promote it from the outset. They've usually been quite open about it. But by nature of lack of transparency, you wouldn't know. So it's almost a self-fulfilling prophecy. And I think, yeah, the whole issue of confidentiality. The best person to tell other people is the person that owns the case or the person that owns the yard. It's not the vet's place to spread that news, and a lot of that can be avoided, I think, if there is this ethos of transparency from the outset. That's easier said than done. And yeah, I could almost understand that well, like you say, they're ingrained within the whole process of diagnosis, and so they're going to get the truth. They need the truth in order to implement the right measures, both for the individual case and for minimizing disease spread. I can understand how perhaps farriers are not going to be as party to the truth as vets are, and that's wrong, because they should be seen as potential fomites, and we all should. Anybody that walks on and off that yard, any vehicle that drives on and off that yard, should be seen as a potential fomite. And again, it's having this awareness that it's for the greater good. That this isn't just for the individual cases on the yard. This is for the yard down the road and the one down the road from that. So it's kind of looking at the collective that I think is important. And again, it comes back to the current pandemic. That the measures that we're all abiding to, or the regulations that we're all abiding to, is protective of us and our family, hopefully. But also, it's seeing the advantage of that within the wider community. Even globally, with travel restrictions and what have you. It's having that slightly wider horizon. In your sights, rather than just thinking it's my horse or it's my yard. It's looking wider than that. So yeah, again, it comes down to education, doesn't it? It really does. Yeah.
Definitely seems to always be when we boil it back down,
Yeah.
always goes back to education. So on that subject, why do you support Strangles Awareness Week? And what do you think horse owners, yards and vets could do to get involved?
I think the good thing about it is does what it says on the tin. It increases awareness, and I think that's vital. That because we tend to become aware of things when we're kind of in the eye of the storm, but when we're not dealing with a strangles outbreak at this particular moment, which I sincerely hope is the case with the majority of the listeners, then why would you think about it? Well, I think it's having that awareness that it may well be that the reason you're not dealing with it is because you're doing things right, and the fact that you're strangles free at the moment is maybe a reflection of the measures that you've put in place. Or it might be good luck. It might just be good luck. It's maybe just it's an accident waiting to happen. And so I think the good thing about any awareness raising campaign is it just gets people to think, to say, okay, well, we're not dealing with it just now, but you know what, we could do this differently, we could do that differently. I think the other good thing about it is again, education, signposting people to resources that are available. And social media is a very powerful tool if used in the right way. So yeah, just getting people to think, just to say, well, okay, where are we at with regard to minimising the likelihood of disease introduction to the yard, and no more an emotive time than to be thinking about that than in the midst of the current pandemic. I think everybody, all the stakeholders in this initiative, I think should be congratulated. I think it's a fantastic initiative. And yeah, I wish everybody luck with it, and I hope it's received very well. I'm quite sure it will be, and it's proud to be part of it.
Well, thank you very much for coming in today and sharing these experiences.
Thank you.
Thank you to everyone who listened in today, and I hope we've managed to answer any queries or questions you may have had. Next up, we spoke to Amy Smith from Northumbria Veterinary Group. Amy is an equine vet, and she'll be talking a little bit about her experiences with strangles. Welcome to the Strangles Awareness Week podcast, Amy.
Hello, thank you for having me. Yes, I'm an equine vet based in Northumberland at the moment. I've just been finished dealing with a strangles outbreak. We had 100 horses involved over 2 yards, and we've just had our last results 2 days ago, so that we're now clear. So yeah, that's my background with strangles at the moment.
What do you think when you first hear the word strangles?
Strangles is a word that still has a lot of stigma around it. It still makes my heart sink slightly, to be perfectly honest. I think I want to work out if it is strangles. The first thing I want to do is do the test, work out if that is what we're dealing with, and then I want to work out how many other horses are affected and the extent of the situation. I think, yeah, there's definitely still a stigma around the word strangles, and it definitely makes owners very nervous, but I think we can work together and reduce that stigma and make it something that's more manageable.
What do you think is the devastating thing about strangles?
I think this is twofold. I think there's the clinical impact on the horses. It can be a very severe disease. In lots of cases it isn't. Lots of cases you have mild symptoms, but we did unfortunately lose a horse during our outbreak. So obviously the clinical side of it is very worrying for the owners. The other side of it is the economical impact. One of my yards was a riding school. We had to shut the riding school for 3 months. We've also had to shut down the competition centre. We had to stop horses being able to go out to compete. We had to stop horses being ridden and hacked. So I think there's big impact for putting the brakes on something for 3 months as well. And I think it is a disease with a big impact. It's a disease that causes a lot of hassle and a lot of stress. That's something that isn't to be underestimated. It's never dealt with quickly.
As a vet, what makes your work easier when you're dealing with a horse that has strangles?
I think as a vet, it's easier when there's a lot of honesty and openness with the client, when you can have an honest conversation about the horse, where it's been, what clinical signs it's shown, how long it's been showing symptoms for. It's always easier when you can have that kind of trusting relationship with a client, and where you can discuss how we're going to prevent that horse from becoming a carrier, how we're going to make sure that horse is not a carrier. I think as well, if the client is open to talking to the rest of the yard, to the other people that horse has been in contact with, that makes it a lot easier. But I do understand that it is a stressful disease. I do understand that clients will find it very upsetting. They will find it very difficult. But I think if you understand that your vet's trying to help you, we want to get rid of the disease as quickly as possible, and we want to make sure that your horse is healthy. And I think if you understand that and you can work with us, I think that's really important.
How do you manage balancing best practice with the client's needs or demands?
This is something that is very important when dealing with a strangles outbreak. It can often take a lot longer than you think. So I asked for all my horses in the red area that had become infected to be put onto box rest straight away. And in most cases this is possible, but in some cases it just isn't. And we had a young horse who's fully fit, show jumper, who was just completely unmanageable on box rest. To go from being worked for an hour twice a day and being turned out to just standing in the stable when the horse had very mild symptoms was just impossible for the owner and the horse. So we had to come up with a compromise. So we had to find a paddock which the owner could walk the horse to without coming into contact with any other horses. They could stay in the paddock for 2 hours supervised, and not come into contact with anybody, and then they could walk back. And we made sure we disinfected everything on the way there and on the way back, made sure that no one else was moving their horses at the same time, made sure the horse was being led in a bridle so it couldn't get away. And that was the only way that we could safely manage that horse. And it wasn't, in an ideal world where everything's perfect, we wouldn't have had to do that. We would have kept the horse in the box, but it's just not possible. And I think you have to be aware of, you have to be a little bit flexible in these situations. You can't just sit there and preach. It's not going to happen. And it would have ended up in a much worse situation where the strangles would have been a very minor problem compared to the horse squashing the owner or jumping the door or something like that. So I think you do have to be aware of what clients need and what they want, and also what the horses need. But the client, on the same kind of turn, the client has to also work with us and realise that we don't want their horse to have strangles. We didn't give their horse strangles, but in some way we have to work together to make sure that that horse doesn't spread it to the rest of the yard, and that is important.
How can vets promote openness and support in the equine community when it comes to infectious diseases?
So as a practice, when dealing with any outbreak, whether it's strangles, flu, anything, we recommend that yard owners and other people are very open with the rest of the community, with other vets, about what they're dealing with, how many cases they have, and how they're dealing with it. So we recommend that they put up something on Facebook or their website to say, this is what we have, this is how many horses are affected, and this is what we're doing about it. As a practice, we also ask permission to ring the other vets in the area and tell them that that's what we are dealing with. And also we recommend that we tell farriers, physiotherapists, instructors, anyone who might go to the yard regularly, so that they are aware and that they know what they're dealing with as well. We often find that when people are open, they get a really good response. Normally there's a lot of support from the community. Normally people have dealt with strangles before. I think anyone who's had horses for a long time will have dealt with it at some point. So people can be very helpful, offer their advice. And I think in general now, I think people appreciate the honesty rather than have a problem with how they're dealing with it, or, think that they should be doing something different. I think it's often better to just from the outset be open rather than try and hide it. I think that's definitely the way forward. And I think as long as people can see that you're being proactive and people can see that you're dealing with the problem and that you've got the vets involved, I don't think it's any detriment to the yard or to the people dealing with it. So that's what we would recommend as a practice for anyone dealing with something like this.
Do you have any tips for vets when working with owners who are going through what can be quite a distressing time? Strangles is a stressful disease, and it can be a bit hard for owners to take everything on board.
I have a good relationship with the yard that I was dealing with, and I made myself very available. I think my yard really appreciated that they could phone me or text me at any time, and we could talk about what was going on, about new cases that had developed. I made sure that I had time most days to go to that yard if I needed to at the end of the day, to look at new cases, to look at existing cases, to talk about biosecurity. We also arranged a client meeting for my yard right at the start to talk about what strangles was. We used the Redwings PowerPoint that we found on their website. So we talked to all the clients at the yard on Zoom about how we were going to deal with it, what to look out for in their horses, why it was so important, and how we were going to clean it up. We also made a document that we passed around to everyone on the yard with all the information written down about who was dealing with the outbreak, how we were going to deal with it, and how we were going to clear it up at the end, and showed them the timeline of what was going to happen. And I think people really appreciated having something written down. I also made sure that everyone on the yard, rightly or wrongly, had my number so that they could talk to me, and it just stopped that spread of misinformation and of rumours, which is so prevalent when dealing with anything like this. So I made sure that if they had a question, they could talk to me within 24 hours and I would deal with it. And we also made sure that there were two vets dealing with the outbreak. We made sure that we were both saying the same thing. So we went off of the consensus statement and we stuck to that absolutely rigidly the whole way through, so that there was no confusing, conflicting information. And I think that helped. We were very firm with what we were saying, and we said the same thing every single time, which just prevented that confusion. I think just keeping everyone in the loop We had a WhatsApp group with everyone in the yard in it, making sure that everyone knew what was happening, which horses were in the red group, which horses became carriers, how we were dealing with that. That helped. But obviously it's a very difficult situation and we did have a lot of stress. It wasn't easy. It was not easy. People got upset, horses got sick, but we're through it now, and I think we're better for it, for the fact that we all talk to each other the whole way through. We're very honest with each other and open with each other the whole way through.
Lovely, thank you very much. Why do you support Strangles Awareness Week, and why do you think people should get involved?
I think there's a lot of misinformation about strangles. There's still a big stigma when you say the word strangles. We all need to be more aware of what it is, what to look for, how to detect it amongst a population, and how to prevent it from spreading. I think Strangles Awareness Week is so important to make sure that everyone knows what they're looking for, how to deal with it, and so that we kind of get rid of the stigma and we realise that it's just a disease. It's something that lots of horses will get. But if people are more aware of it and more aware of how to deal with it, more aware of how to look for these carriers when moving horses, then hopefully we can start to eradicate it amongst the population and really reduce the prevalence of the disease as much as we can.
What is the first thing that horse owners have to do if they think that there is strangles on their yard?
Obviously, it goes without saying that you should isolate the horse, not let the horse be in nose-to-nose contact with anyone else, and make sure that you are, not sharing tools, equipment, water buckets, and while you're waiting for the vet to come. And that would be a good start. I think that would make every outbreak a lot simpler if people just spoke to the vet straight away and got them on board and told them what was happening. I think make an appointment, say that you're concerned that there are strangles, make sure that they're aware that that is the problem. Then you should go onto the Redwings website and have a look at all the information there. There's lots of information about biosecurity, about the disease itself, that can be really helpful. And then I think speak to your vet, work with your vet and get the testing done, work out if that is what you're dealing with, and then work with your vet on how to clear it up as quickly as possible.
Well, thank you very much for having been with us today, Amy. It's been really great to hear about your experiences and getting to hear about your advice on strangles.
Oh, no problem. Thank you for having me.
It's been a pleasure. Thank you so much for listening, everyone. Follow the Strangles Awareness Week Facebook page for more information about strangles and the campaign. Or if you have any further questions, leave a comment or get in touch with us by emailing campaigns@redwings.co.uk. We will see you tomorrow for a next episode, available on YouTube or on your podcast player. Let's spread the word and not the disease.